Hey, it's Coach Mark. I want to give you some self-care tips to try to help treat your sciatica, right? A lot of people experience some sciatica, and it's not always related necessarily to a problem in your lower back. It can be more associated with your hips, tight hips, weak glute muscles. And so I want to give you some self-care tips that might help you out with that. So first thing we want to try to do is some soft tissue massage. You can use any number of tools. You can get yourself a ball, a cross ball, softball, even baseball. If you can put it, on that backside area where you're feeling some tenderness and soreness, you can roll back and forth for a couple minutes and activate that, get some blood flow circulation through there. Another tool you can use is just a massage stick. All right, so we can come down here and work on massaging that area, or maybe a foam roll. If you can tolerate sitting on it and rolling back and forth, that can roll out that area. Now, once you're done massaging, getting some blood flow circulation going through there, you can work on some activation to try to strengthen those muscles up a little bit. One exercise that we can do to try to strengthen the glute muscle, we just do a bent knee heel raise, so we can lie down on your stomach. You're gonna try to bend your knee to about 90 degrees, try to keep your foot pointed up towards the ceiling. And what we're gonna try to do is lift your foot off the ground slightly, just enough to clear your thigh off the ground. Pause for a second or two, lower it down, reset, and then we're gonna repeat from there. Now, where you wanna feel that is basically at the top of your thigh, top of your hamstring there, up into your backside, into your glute muscle there. Where you don't want to feel it is down lower in the hamstring. So if your knee is not bent to 90, if it's not bent enough, and you lift up, you're probably going to feel it more in your hamstring. Or if you're lifting too high, you're probably going to feel it in your lower back. So you just want to feel that right back there in that backside. Again, pause for a second or two, lower it down. 10 repetitions should be fine for you to feel some fatigue back there. A second strengthening exercise you can do is a bridge. You can lie down on your back, knees are bent, feet are flat, and you can try to push through your heels and raise up into a bridge, about a 45-degree angle. Really tighten up and feel the muscles on the back of your thigh and backside working. Again, try to hold for at least a 5 count, lower down, and you can do 10 repetitions there. You can hold a little longer, that's fine too. Good isometric hold. If you want to challenge it even more, you can try to do a single leg bridge where you can lift the opposite leg off the ground, push through there, and again, really activate the muscles on that side. So we can do those two. Then, after the strengthening exercises, we're going to try to stretch out the hip and backside, particularly the piriformis muscle. So if you're able to, you can lie down on your back, cross a leg over, so we're trying to stretch this right side, cross the foot over onto the opposite knee, and see if you can bring that left knee up towards your chest so that you're feeling a stretch on the back side back here. You can take a deep breath in and out. And then relax. And try to perform at least 5 to maybe even 10 repetitions on that. If you have trouble reaching that knee, bringing it up, you could wrap a towel or a strap around your leg to help pull it up so you're not straining your neck just to lift up. A different alternate position, you can sit up and cross the leg over and try to pull this knee towards your opposite shoulder. So again, you should feel the stretch down here in that piriformis area. Deep breath in, exhale, let it out. And then finally, if you're not able to get down on the ground, you can always do it from a seated position. You can sit in a chair, you can cross that leg over, and again, you can try to pull that knee towards your opposite shoulder to feel that stretch. Or you can try to lean forward and feel the stretch back here. Again, deep breath in and out, hold for a count of 5, let it out, anywhere from 5 to 10 repetitions. So again, recap self-care techniques for that sciatica. That's usually a piriformis muscle issue, a hip tightness and weakness issue. So some soft tissue work to open that area up, get some blood flow and circulation, whether you're using a ball or a stick or a foam roll. Some activation. Lying down, a heel raise towards the ceiling, or a bridge, and then finally a stretch of the piriformis muscle. If you do all those 3 on a consistent basis, I have all the faith in the world and confidence that that piriformis will start to loosen up, that sciatic nerve will start to release, and you're going to be feeling a whole lot better. Now, if you need help with any of that further, feel free to reach out. Again, we can help you out through our Fit for Life or ISO Strong or Smart Stretch Therapy programs. See you again soon.